We have all seen or heard of the college football or soccer star who has seemingly ended their career due to an anterior cruciate ligament tear. In our presentation, we look at hormones and whether or not, or how, they may affect ACL injuries. Let's first look at the gross anatomy of the anterior cruciate ligament. The ACL is located on the anterior aspect of the knee. It provides stabilization and prevents against rotation and anterior translation of the tibia. While nearly all ACL injuries result in a complete tear, there are three grades of injuries to the ligament. Grade 1 is a mild sprain. This means the ligament has been slightly stretched, but it's still able to keep the knee stable. Grade 2 is also known as a partial tear. This is a stretch of the ligament which causes the joint to become loose. As with most ligament or tendon injuries, rest and slow recovery is crucial, as the tissue is not as vascular as many other possible injuries, so the recovery time is slower. Finally, grade 3 is a complete tear of the ligament and allows for no stability of the knee. These injuries often result in surgery. How does an ACL injury occur? Believe it or not, approximately 70% of ACL injuries are non-contact forces. This being the result of landing, cutting, pivoting, decelerating, or planting the foot with a twist of the upper part of the leg. The other 30% can be attributed to contact forces. This can be a valgus force with a blow to the anterior portion of the knee. Sports which have shown a high risk of ACL injury are basketball, field hockey, gymnastics, soccer, lacrosse, and volleyball. You'll notice many of these sports involve jumping, landing, dynamic multi-directional movements, and use of cleats, which add more traction to the lower limb. In this still frame, we see an example of how planting and twisting forces expose the ACL as the weak link in a soccer player. There are some factors that are categorized as internal or external risk factors. Shown here are examples of each. We already spoke about the external risk factor of cleats and how they can cause a normal twist of the foot to remain stable while the upper limb rotates. An internal risk factor that seems to present in many cases is muscular imbalance. Mentioned here is the dominance of the quadriceps muscles over the hamstrings. This imbalance places greater torque on the knee versus more balanced musculature. The hormonal internal risk factors we will discuss shortly. In a look at whether male or females are more susceptible to ACL injuries, we found that female athletes are 2 to 9 times more likely to experience an injury of the ACL than a male in the same sport. Why? We will now talk about the hormones which influence the possibility of ACL injury. During the female menstrual cycle, we will discuss the hormonal fluctuations which increase the risk for injury. Now, we'll take a look at how hormones may affect the prevalence of anterior cruciate ligament injuries. The research we found presented 3 main hormones affecting ACL injuries: relaxin, estrogen, and progesterone. Relaxin is part of the insulin superfamily of insulin-like growth factors, and relaxin. It has a collagen-lytic effect and is only present in females. Relaxin is at its peak 7 to 10 days after the luteinizing hormone surge of the menstrual cycle. Receptors of the hormone are present on the ACL of females and affects the structural integrity of the ligament. Because relaxin is collagenolytic, it is possible that the structure of the ACL is compromised when serum relaxin concentrations, or SRC, are high. In a study of 128 female college athletes, when SRC levels were detectable, it was found they were significantly higher amongst females who experienced ACL tears versus those who did not. Estrogen is one of two main female sex hormones and is responsible for female physical features and reproduction. This hormone also helps to control the menstrual cycle, which we discovered is when the previous hormone relaxin is present. Estrogen, like relaxin, has been found to have receptors for the hormone on the ACL. And also like relaxin, estrogen has been shown to affect collagen levels, which in turn makes ligaments more susceptible to injury. In a study by Bell, he and his team found that estrogen can make the ACL more susceptible to injury because of muscular strength and stiffness. Progesterone is the other main sex hormone found in women and is prevalent during the menstrual cycle, just like the other two hormones we have discussed. Progesterone receptors can also be found on the ACL, and when present, especially during the menstrual cycle, there has been correlation between hormone levels and knee laxity. An increased laxity of joints shows an increased risk of injury to the ACL. In men, similar findings have been found. Subjects who presented with ACL injuries were found to have greater concentrations of estrogen, testosterone, and joint laxity. In conclusion, we have found and shown through research that hormones in fact do have an effect on ACL injuries. Also, due to structural and hormonal components, females do not only have a higher risk, but a higher incidence of ACL injuries.